All right, well, if you're watching that segment right now and you're thinking to yourself, I would love to be able to do that, but I'm just in so much pain. My back is just killing me, and I just don't think I could handle that. Well, let's take care of that and get you out doing yoga or playing golf or tennis or just going for that walk. Dr. Nicholas LaHood from the San Diego Spine and Disc Laser Pain Center joins us here this morning. It's good to see you.
Good morning. Thank you.
For some folks, they're watching that yoga segment, and it's painful for them just to sit and watch it, isn't it? Both emotionally and physically.
You know, 90% of Americans will have severe back pain at some time in their life. That's according to a study by United Healthcare Insurance Group. And a majority of that pain comes from a herniated or degenerative condition with their spine. They're unable to enjoy life or do those yoga poses or just get out and walk and run normally.
See, and that to me is just a shame, and I just can't even imagine that. As much as I enjoy getting out and around here in San Diego, I mean, that's one of the reasons we live here.
Right.
So if you are suffering from this kind of pain, you say it's usually a disc problem. What is it? Is it genetic? Is it an injury? Is it just over time the discs break down? What happens there?
That's exactly right. Usually over time it's a degenerative condition that builds and builds. Patients, you know, there was an analysis done by Medicare, and an analysis of the Medicare records show that there's 90 million epidural steroid injections done in the United States every year. And the doctors are trying to treat and use these steroids to reduce the patient's pain and inflammation of their back. But we know if it is a herniated disc or a degenerative condition, that's only going to be a temporary fix.
It'll make it feel better, but it doesn't handle the herniated disc problem. Okay, folks, there's a solution here, and it's totally non-surgical, and they'd love for you to try it. Absolutely risk-free, no cost to you whatsoever. 2 free treatments of spinal decompression and a laser treatment that goes along with each of those decompression treatments. So, doctor, here's a beautiful illustration, an animation here of what happens when you decompress the spine. Can you explain that?
The disc breaks down from the outer annulus fiber, and basically so much pressure on the patient's back, the disc is bulged and herniated. They can have symptoms of sciatic pain, weakness in their legs, difficulty walking. When we use the decompression, Mark, it actually releases the pressure off of the herniated disc and pulls it back away from the nerve.
So the nerve is what's causing the pain, the nerve that's being pressed upon, and it's the disc that's pressing on that nerve. Now, you do this gentle decompression, and I mean it is gentle. I've watched people falling asleep in the office during this procedure. Again, totally non-surgical. But it's not just pressure. Explain how there's like a pumping motion that goes along, and why that's important.
You know, it's a process called imbibition of taking the pressure and unloading the spine. You know, just like you said, it is a non-invasive treatment that's pain-free and gentle. It pumps fluid back into the disc. You know, there's 90 million of those steroid injections given last year. So whether you're using needles or knives, this treatment is relaxing, it's non-invasive.
And what we want to do is avoid the surgery. And folks, you know, they're going to be honest with you. If you come in and they give you a couple of these free treatments and the laser treatment on you, and if you don't respond to that, if you don't feel significantly better, they're going to let you know. But you can help about what percentage of people? And this is the number I love to give folks.
It's about 86%.
So about 86% of the folks that come in can avoid surgery, have the pain relieved in their back, and it's a permanent solution as well. And that's where the laser comes in. So kind of explain that, because I think intuitively most people understand, hey, you can take the pressure off my spine, but when I stand up and start getting active again, I'm going to put the pressure right back on, that disc is going to bulge out again.
So San Diego Spine and Disc was the first in San Diego to bring these Class 4 lasers to the public in this fashion. It will increase the blood flow. It'll dilate the blood flow and bring in oxygen to those ligaments and discs to speed up the healing process, Mark. So it is a long-term solution for that degenerative condition, and it acts as a natural pain reliever at the same time.
And this Class 4 laser is supposed to be able to heal or help the body heal on its own, but 3, 4, 5 times faster than if you didn't use the laser.
Very quickly. And you know, my favorite part about those lasers is that there's no side effects to it. It's not like taking a strong pain medication or constantly taking Advil or Tylenol. There's no evasiveness to your body. It's a natural, safe way to treat pain.
So folks, you can make this appointment for yourself, You can make it on behalf of a spouse, a partner, a loved one, or even a friend. All we ask is that when you make the call and you make the reservation, just make sure that somebody uses this appointment, because it's absolutely free to the first 25 callers. You experience the spinal decompression, you have a consultation, and you experience the laser treatment as well. And doctor, a lot of folks say that just after those first 2 treatments they can feel a difference.
It's amazing. They feel a release of the tension that's been there for years in their back. We just get such consistent, great results constantly.
All right, folks, so take advantage of it. Again, no obligation whatsoever. They just want you to feel better. If it works for you, great. And if it doesn't, they'll refer you to somebody else. Just no questions asked. For more information, you go to sandiego6.com. You click on San Diego Living. It's San Diego Spine and Disc Laser Pain Center and Dr. Nicholas LaHood.